Welcome you all to this session on artificial intelligence in ophthalmology. Many of us may be familiar with the term AI. Actually, in simple words, AI means they are computer models which are capable of learning from data, and they can analyze the images and come to conclusions or solve problems just the way we do. So in every aspect of our life, AI is encroaching into it. In healthcare, it has got a tremendous role, especially in ophthalmology, because we are more of an image-dependent specialty. The role of AI is actually transformative. So in this session, we are trying to explore the applications of AI in different aspects of our practice. In the first two talks, it will be focusing mostly on clinical and healthcare delivery applications. In the third and fourth, it will be on academic and research applications of AI in ophthalmology. And lastly, I will be talking about the limitations of AI, where you have to be cautious so that you can use it in a very effective and safe manner in your practice. So with this introduction, I am inviting Dr. Rajiv Sukumaran, who is the senior most tech-savvy ophthalmologist among us, who is already using AI in his practice. So he will be talking on the clinical applications of AI in ophthalmology.
Good afternoon, everybody. Nice to see a big crowd for AI. It's going to be one of my projects, and I'm very happy to see so many here in this hall. So if you look at the evolution of AI, first it started in 1950, it peaked and then came down, then it went up. Now it is a boom. It's a big explosion-like improvement. So if you look at the different levels of AI, it's the machine learning, it's just the pattern it learns. A deep learning is there. CNN is something like a cortex, different level of interpretation. First it analyzes the color, then the shape, and it goes on. And then you have the generative AI. That is, it will create its own database. That is one step higher. Then the chat box is there. So the large language models, what we have is the Google. You would have heard about ChatGPT 4. Now even 5 is just coming out. Gemini from Google, Microsoft, Meta, Llama from Facebook, and Chinese DeepSeek is doing wonders now. So if you look at AI in an ophthalmology, rise in AI is in healthcare. Ophthalmology is the image-driven specialty. So you've got a lot of images, can analyze and give you faster and more accurate diagnosis. So the diseases what we deal is the diabetic retinopathy, ARMD, glaucoma, ROP, cataract, and keratoconus. So why AI in diagnosis is that image-based detection, deep learning with fundus and OCT images, and early detection and disease grading. So AI in treatment also, predicting disease progression over progression, personalized treatment, teleophthalmology, surgical planning using AI model, and robotic surgery, it's coming into. The prominent AI models and system what we have now is the IDXDR. Then the Google Deep Mind, which is called the retinal disease detection, and iNuke, Reti AI, and Orbis International AI. So IDXDR is the first FDA-approved autonomous artificial intelligence model. It's a deep learning model, can diagnose diabetic retinopathy without human intervention, high sensitivity and specificity, specifically focused on more than mild diabetic retinopathy. So this is the integration of the AI into the OCT machine of Topcon. So Google Deep, now it is called the Google Health, AI-powered solution for various healthcare. They have the Streams app, which uses AI to predict patient deterioration and alert clinicians. This is not ophthalmology. In ophthalmology, the diagnosis and predicting retinal disease. The prominent one is the ARDA with Aravind Eye Care system. So Google and Aravind Eye Care developed a deployed AI algorithm for screening diabetic retinopathy and detecting early onset of blindness. ARDA means Autonomous Retinal Disease Assessment System. It's a CNN, that is deep learning, and further is CNN. So it is CE approved for AI learning. It started in 2017. Aravind provided a large database of retinal fundus photographs. That is the significance of the study, because they use their own data. The experts from them manually graded the images for diabetic retinopathy, which is used for their study. Enabled screening at scale in rural and semi-urban setting. Reduce burden on ophthalmologists by filtering non-critical cases. Improved early detection and reduce risk of vision loss from diabetes. So about 6 lakhs patients were screened till 2024. High sensitivity, 96 to 97. The significant point you have to note here is there was 8-fold increase in detection of treatable stage. That means we were missing 7 out of 8 when we did it manually. So look at the importance of AI. Caught 100% the patient with severe non-proliferative and proliferative diabetic retinopathy. Highlights risk of systemic events. That is, with looking at the fundus, you can predict whether the patient can go in for a cardiovascular events. This is yet another study. I'm not going into the depth of it. And these are some of the prominent AI models in ophthalmology. And these are the pictures using AI models. So Orbis, again, is a similar one with the high, they were focusing on ROP. Diabetic retinopathy in kids, not ROP, it is diabetic retinopathy in kids living with diabetes. That is the type 1 diabetes. So future in AI in ophthalmology can be explainable AI. Multi-model data integration like OCT, fundus picture, ICG, all those you can integrate it. Predictive modeling, you can predict by the progression, you can real-time monitoring, you can do AI in surgical planning, personalized medicine. So real-world integration summarizes you have about 100 visits for a patient, summarize the entire thing and give it to you. And diagnosis and other improve and image-based analysis for differential diagnosis. So this, if you give your data, the AI will tell you what probable diagnosis is it, and whether you're missing any finding, all it will give. This is chat box from ChatGPT. And this, you give a picture, it will give you the diagnosis. Interpret. And this is yet another picture, it will give you diagnosis, and it will even suggest what you have missed and what can be done further. This, I'm working on it. It is a fantastic one, especially people who are in who are standalone, who don't have a second person to get an opinion. You use it as an intelligent assistant. It will not take away your profession. Just don't be carried away by that. And these are the future plans in EMR, what we are doing. The third one is what I'm working on, real-time voice detection and AI-based documentation. So you sit and talk with the patient. Whatever the patient says, whatever the language, it will interpret, and in your EMR, it will start typing. Whatever, if he says, chorin, vedana, everything, it will come. Itching, pain, like that. Then you can dictate the terms, what you want. Yes, the patient has got papillary reaction. Automatically, it will come into it. Okay. Even if they talk long, it will summarize and give you the, ultimately, they'll talk too much, then foreign body sensation. That's it. It will predict and tell you. Then personalized treatment recommendation based on AI models. So it will go through journals and tell you which is the best treatment for a particular patient. So prompt engineering, what I was talking about, personal respond on AI trained ophthalmology consultant, as is securely by API. That is a little depth. I'm not going into that. And if you look at this, this study says we predict that impact of superhuman AI over the next decade will be enormous, exceeding that of industrial revolution. You have heard about industrial revolution, which changed the world entirely. Similarly, it's going to happen in the coming future. So AI is not intended to replace ophthalmologists, but rather to augment their capabilities, acting as a powerful assistant tool. AI will undoubtedly become an indispensable part of ophthalmic practice. Take it from me, the youngsters, in the next 10 years, if you don't learn AI, you'll be out of this profession. That is for sure. So don't look at, I'm sorry for this picture, don't look at AI like this, look at it in a proper way. Okay, understood. Sorry for the picture. Okay, but it gives a lot of meaning. Okay, thank you. Did I stop?
Thank you so much, Dr. Rajiv, for introducing the clinical efficiency with which AI can work and the various, whatever is possible in our practice, be it in healthcare delivery or in clinical diagnosis. Now we will go to the next talk. Thank you so much. He's busy and he can leave. Yeah, I know. Thank you. Thank you so much. Next talk is by our young generation tech-savvy person, ophthalmologist among us, Dr. John Davies Akkara. He will be talking on integrating AI into your clinical practice and future directions.
So that was a very informative talk by Rajiv sir, and we should look at AI differently. Don't think that AI is going to take our jobs. Person who learns AI is going to take the job from the person who is not using AI. So that is what is important to learn. So AI definitions, I don't want to cover this. AI is everywhere in modern life. So ChatGPT and Siri and whatnot, and like evolution of man from monkeys. So this is AI becoming robots and all the autonomous cars, everything is available. The search for AI, if you search in PubMed, there is a sudden increase in the number of searches and number of articles. Everything is going towards AI. In IJO, there are so many AI articles. Even in KJO, there are so many AI articles. These are some of the AI articles that I have written. And it's there in glaucoma, it's there in clinical diagnosis. It's seeing not only glaucoma and other eye diseases, it's looking at systemic diseases, oculomics. You can look at the retina photo and say this person might develop Alzheimer's or Parkinson's, or this is what this person will die in 5 years. That prediction can be made with fundus photo because it can look at cardiovascular risk. So all these things are already there. And why ophthalmology has a lot of AI? Because ophthalmology is full of images. Images starting from slit lamp, fundus, OCT, FFA, anterior segment OCT, everything, B-scan, topography, and lots of numerical data, IOP values, refraction values. Visual fields is not actually image, it is all values. Everything like this, it is called big data. Big data is what feeds AI. That is why ophthalmology is the branch for AI. And lots of things, can we trust AI? We'll find out. We'll have to keep a bit of salt for AI. Clinically, lot of diseases in ophthalmology, AI can diagnose and can also help to treat. It can help you to say what is the IOL power which you have to put for this patient with a very complicated eye. You can plan the squint surgeries. You can plan how many intravitreal injections a patient might need. This is a question which the patient will ask you. You told doctor that I will need intravitreal injections, maybe 1, maybe 5, how many, doctor? So you can answer that with the help of AI. It can predict. And as I said, oculomics, it can diagnose cognitive impairment, dementia, Alzheimer's, stroke. All these things are already there. They are published articles showing that you can detect some of these diseases from the fundus images and OCT pictures. And that is called oculomics. So we covered that already. And I have written an article in KJ about the same thing. And one other thing which all of us are familiar with are the large language models, ChatGPT, Claude, Gemini. All of these things, they are AIs which have been trained on lots of text data, and it can summarize research articles. It can even create a presentation for you. This part of the presentation is partly made by AI. So it can even help you study. It can read all the articles, make things for you. It can help you think of research ideas, think of what to do for your thesis, everything like that. Okay. And generative AI creates things such as new text, new images, videos, audio, even computer code. You want to make a program to find surgical induced astigmatism. You don't know what is programming. You just tell the AI, it will develop the software for you, and you can put your name on it and you can say so and so's SIA calculator. Very easy now. And that is the difference between discriminative AI and the generative AI. Discriminative AI is what looks at a fundus image and says this patient has grade 3 diabetic retinopathy or whatever, and the generative AI creates something. Okay, so another thing is notebook LM, which is very useful for learning. This problem with AI is it can make up hallucinations. It can give you content which is not real. Notebook LM, it is based, grounded on data which you give it. You can tell Notebook LM, okay, look at these 10, 20, up to 50 articles, including YouTube videos, and tell, okay, look at this content only and create a summary for me. Create a summary so that I can learn about refractive surgery and artificial intelligence. So this is my process for learning about a new topic. You give the content, all the content which you are supposed to look through, you filter the content, and then Notebook LM will give you all sorts of things, including it can give you a podcast. It can generate an audio podcast between two AI speakers, and you can listen to it while you are driving, while you are in the gym. So it is making learning very efficient. AI in medical records, you saw Dr. Rajiv Sukumaran, he is talking about AI which will listen to your conversation with the patient. Patient comes and says, Kannu vedana undu. It will say, patient complains of pain. Everything is going to be converted into an EHR record, automatically translated between languages, and then it will ask you, we forgot to ask how many days he has this itching. So all those things, it will listen to you, fill up the data, it will tell you what is missing, it will guide you. So it's a guided, AI guided EMR. So that is right now in the works. It is almost here. This is another app. Okay, this is Uveoscope app, which is for uveitis patients, which myself and my wife, Dr. Anju, we have developed, in which you put the history of the patient, you put the details of the patient, it generates a summary, then you put the examination findings of the patient, it generates a summary, then using that, it gives you a list of diseases which could possibly lead to this particular set of symptoms and findings. So that is also there. And this particular thing is an AI which will take the history. So all these things are going to be time saving. So doctors who are going to be using AI efficiently are going to replace doctors who are not using AI. So will AI take your jobs? Yeah, like this it might. AI integration gap is there. So all of you, you are going to learn about all the things which are available. What are you going to do? What are you going to use in your practice when you go back Monday morning? So today there is a generative AI session happening in the conference. You can learn how to make AI generated PowerPoints and learn to do your own statistics with AI, so many other things that is going on. And you can learn some of these things yourself as well. And why now? Because there's a doctor-patient ratio in India is quite a thing. So you need to be more efficient to cater to more people. And patients are also very tech savvy. They want AI. They know AI. They have all access to the regular chat GPT and Gemini. They are learning about various diseases before coming to you. You will get all those patients. Next few months, you're going to get patients who will tell you what to do. Okay. You have been getting that, but now they will tell you with evidence, because they are going to get evidence from ChatGPT. And cost effectiveness. AI is not expensive to use. Everything is now very cost effective because it's just software. So first you dip your toe, you wade in and then dive deep. We'll start with how you can get started. You can use AI to transcribe, and so that is what Dr. Rajiv Sukumaran said. So that is going to be the easiest to start with. You can use probably AI to make patient education materials. That is probably easier to start with. You just tell Gemini or ChatGPT, make a brochure for my hospital. It will do that. So that you can start very easily. Monday morning you can do that. Administrative automation also a little more difficult, you can do that. Then you go into little more hardcore, you go into like clinical evaluation, diabetic retinopathy screening, glaucoma screening, etc. Going to be a little more difficult. OCT analysis is going on. OCT with more advanced AI can detect other systemic diseases. AI can improve the image quality from regular fundus cameras. So maybe you take a smartphone fundus photo, AI can enhance that image. That is also possible. Then when you go into deeper into AI, you can have multi-device AI. So all the OCTs, fields, fundus photo, everything together will be looked at by AI and will guide you on the treatment as well as anything you missed. It will tell you, okay, this is there, but maybe you should do another test to diagnose the case of uveitis or whatever. Then prediction. Patients can be told, this is your current visual fields. In the next 5 years, if your IOP is this much, this is what your visual field is going to be. You can generate that visual field, generate an image, and show them this is what is going to be. So you need a collaborative diagnosis. So future critical, you need clinical care, expertise, innovation. All these things are the directions in which it goes. So you will be able to predict the future. You will have video analysis AI, which will look at your surgical videos real time and tell you, wait, the hydrodissection was inadequate, please go back and do that. Or it will tell you, don't go close to. So all this is currently possible. There are AIs which can do that in research. It will come soon. Oculomics, all patients will be screened by ophthalmologists for systemic disorders. You will be sending the patient to the physician telling, this patient has so-and-so disease, please take care, instead of the other way around. So that is what AI is going to do, and it will help in teaching, and so many things are going to be completely assisted by AI, even marketing and stuff. So these are the steps I want you to take. Go back and start with one step on Monday. Thank you.
Thank you, Dr. John. That was a wonderful exposition on the practice and future directions of AI. Now we have somebody who will tell us about the use of AI in teaching, especially somebody who has been using it in undergraduate teaching. Dr. Bini will tell us about ophthalmology, learning, education and training in the era of generative AI. Dr. Bini ST.
Thank you, ma'am. So I'm going to talk about ophthalmology learning, education and training in the era of generative AI. So I'm going to tell only the basics of use of AI in the teaching. The different AI technologies like generative AI, large language models and chatbots are very helpful in ophthalmology training. It's helpful in UG, PG training, medical faculties and patient education. The key applications are synthetic data and image generation, simulation and interactive training to create personalized teaching materials and curriculum development. The challenges with the AI is it's not always a reliable source for scientific evidence like PubMed. This PubMed gives credible scientific literature. This AI can produce hallucination. That means the information they provide may sometimes be inaccurate, outdated, or even completely fabricated because these chatbots will generate text based on their trained data. That means they reproduce what they have been trained. Coming to the users one by one, we can create simulated patient or we can create patient scenarios for residence training. It can be useful for rare diseases. We can prepare some questions like OSCEs based on the clinical scenarios. So here I am going to create a clinical scenario of 26-year-old male with optic neuritis left eye. And this is the table I got after giving the prompt. So the tool I am using is Gemini. I am giving the prompt. So AI is giving back all the details of a patient of optic neuritis like history, examination findings, diagnosis, management and even follow-up. The medical images can be generated like this. The GANs are used to generate synthetic medical images. It can improve existing images and also it can augment low resolution images into a high resolution one. These images can be incorporated into that clinical scenarios and can teach the residents. The next use is clinical diagnosis. This AI can assist clinical diagnosis. It can be useful for undergraduates and postgraduates. The clinical assistants are chatbots that help you to make a diagnosis. Only thing is you should give the history, symptoms and signs of the patient one by one to the AI, and if you have photos you can upload that also. The AI will give you back the diagnosis, differential diagnosis, management and follow-up, which can be used for training. You can use ChatGPT, Gemini, Grok or Perplexity, but you can also use fine-tuned LLMs like Lucia. Here I am giving the patient details. A patient presented with redness and pain with anterior chamber cells and flare. So AI is giving the differential diagnosis, management and follow-up. Similarly, the lesson plan can be prepared for PGs and UGs. Suppose I want to create the lesson plan for topic cataract. Total duration I get is 6 hours, and if I give the prompt to the AI, it will give you back the distribution of topics and duration and the activities in each class. Here again the tool used is Gemini. Here I am giving the prompt. It's giving hour by hour distribution of topics and what are the activities we can done in each class. A structured class schedule can be prepared with the help of AI. It's very helpful for MBBS students when we are preparing the class schedule. So in the first half, it's giving all this overview of that class schedule. In the second half, it's giving day-by-day activities. I gave only the prompt like create this class schedule for MBBS students in ophthalmology posting. AI can also assist topic preparation for teachers or faculties. Suppose I want to take a class for postgraduate in the topic keratoconus or for a case discussion, I have to give this prompt. This is the prompt we have to give, or you can modify according to you. And finally, you refer the articles from PubMed to reduce the hallucination. You can use Gemini and Perplexity AI. Here only thing is you should activate the deep research option to reduce the hallucinations. So here I am, here I activated the deep research. This is the Gemini. It started searching. This is what I got about keratoconus, all the details, differential diagnosis, this signs and symptoms, management, investigations, and even recent advances. MCQ can be created in a similar way through AI. It can be used for making questions. You can use ChatGPT and give the prompt like create MCQs about keratoconus for MBBS students. The different difficulty level questions can be created, and or the type of questions you can adjust this knowledge recall or clinical scenarios. All it's according to your prompt. This is a question created by ChatGPT in the topic keratoconus. If you want, you can create explanation for each question also. Or you can use fine-tuned LLMs like MCQ Creator for this MCQs. Question paper can be also prepared with the help of this AI for UGs and PGs. Here I created these questions in the topic corneal ulcer. You can adjust the number of questions like how many MCQs you want, or how many short questions and essays like that. So here it is creating the MCQs, the short questions and essays. You can create the PowerPoints in this AI tools. Here I use the Gamma AI to create PowerPoint. You can edit pictures or add tables or diagrams you want. You can upload your PDF file And here it is creating the, already created the this PowerPoint. You can adjust the number of slides and you can edit whatever you want. You can create posters in the same tool or can use any other tool to create this one. So here it is, I have uploaded my PDF file and it is creating the poster. The flyers and brochures can be prepared with the help of AI. This is the flyer I prepared with the tool Canva. It will take only 5 to 10 minutes to create these type of flyers and brochures. Patient education materials can be created with the help of AI. Suppose I want to create a leaflet for this contact lens users about the contact lens care. I am giving prompt to the AI. Here it is creating in English and it is in Malayalam here. Here I am getting all the details about contact lens care. You can edit according to your convenience or according to your need. You can generate in these videos or patient education, different types of patient education materials through AI. AI incorporated instruments can be used for this screening purposes like ARDA and IR diagnostic assistant. Surgical performance can be assessed with the help of AI. It's a developing tool called Circlage. You should upload your video and it will give you back a feedback like errors, a surgeon's level of performance and examples of how to improve, etc. So start using AI tools to enhance your education standards and maximize productivity. This will help you to save your time, verify safety and the reliability of AI tool used, and assess the quality of AI contents created. Apply your knowledge and intelligence to modify what AI gives. The best AI users are the ones who remain perpetually curious about what could go wrong. Thank you.
Thank you, Dr. Bini. That was very interesting and something we could actually go back and use. So I want everybody to acknowledge that this is something which you will start using as soon as you get back your OP. And Monday onwards, all your patients will have patient education materials. All your students will have good plans of the teaching. Next, we have Dr. Smita. She is going to talk to us about the use, misuse, and future applications of LLMs in ophthalmic research and publications. Over to you, ma'am.
Thank you. Good afternoon, ladies and gentlemen. Thank you, Dr. Reena, for this wonderful opportunity. By now, I'm fairly certain that there is not even a single person in this room who has not used a large language model like the Google Gemini or the ChatGPT to write a speech or to write a formal WhatsApp message. AI is that popular. And it is also useful very much in ophthalmology, as our previous speakers have pointed out. This ChatGPT and its many versions and the Gemini are useful for literature search, data analysis, writing an article, and also for peer review process. So for literature search, I use the Notebook LM. And this is how the home page looks like, and it has now become my virtual research assistant. So all I have to do is to go to the Discover Sources button and then type whatever is needed by me. And then after whatever I am interested in, I get a selection of the sources that are available with Gemini. Now, till now, it is just like an ordinary Google search. What distinguishes it is that the notebook is able to provide summary of each of the articles that I have selected. So I don't have to read the whole article. This summary is so good that I can directly use it into my protocol. Besides, there is something called the chat option. you just type whatever is your doubt, say in your data analysis or in the scientific content, and that doubt will be cleared by the chatbot. Though personally speaking, I think the chatbot has a long way to go about the scientific content. Another very interesting feature, which was also pointed out by Dr. John, is the studio feature. Now you have got your summaries, now you want to know how to present it, or maybe you want to hear it once or twice or thrice so that you can understand it well. So it can present or give you an audio overview or a video overview. So it's very interesting to hear those summaries in the form of a podcast or in the form of an interview between two people, so that you can understand the finer nuances of what you have selected. So this is how a mind map would look like, where the summary of each of the article you have selected, you will get certain points, and when you click on certain points, you will get further details of the points. Besides literature search, the large language models are also useful in research. You know that the heart of the research is the hypothesis. Now, human beings from time immemorial have created hypotheses in tens and thousands. But the large language models are able to create billions of hypotheses. But the only difference is that the hypotheses created by the human beings are imbued with intuition and creativity, while those with the large language models do lack imagination. These models are useful for data analysis. They can read the data, they can plan steps for data analysis, they can write a code, a Python code to perform the analysis, and then present the results in the chart form or in the pie or in your box and whisker, or multiple forms that you like. However, what I want to point out is that this is just like a glorified version of your SPSS tool along with the chart option of your PowerPoint. I don't think it is a very evolved option. It has a long way to go. The most striking use of these large language models like ChatGPT is in providing assistance for writing a manuscript. Very helpful to write an introduction of your manuscript. So much so that Sikandar et al. Found that ChatGPT-4 and human researchers are equal in writing scientific introduction sections, and that too by a randomized control trial. You can write your first draft and then refine it with a large language model service like Paperpal or Grammarly. I shall share my experience with you. I once wrote a manuscript, which frankly speaking I was very proud of, and then I submitted it to the manuscript submission site of a major journal. They asked that I should route it through Paperpal, and when I submitted it into Paperpal, I was sort of horrified to see that it made 32 suggestions to correct it. Anyway, I incorporated all of those suggestions and submitted it, and it requires multiple submissions, and submitted it, and then one of the final drafts actually resembled what I had submitted initially. So this actually, I believe that this is good for people who are not very proficient in English language. It is also useful to generate keywords and references and citations. The best use, I believe, is to write an abstract. I use the free version of ChatGPT. All I have to do is to write a prompt, write an abstract of 250 words with title and purpose and methods, results and conclusion. And then I upload whatever my scientific data or tables are. And then I say write 3 keywords and 5 references also. And within a minute, you get an abstract, which is like which is very excellent abstract. The title is great, the purpose is well stated, the conclusion is so precise. And when you look at the keywords, they are so apt. And the references are in the Vancouver style which your journal requires. However, when I cross-check the references, I find that 3 of the references are fake. And this has happened to me with Perplexity also. I was supposed to create questions for some exam, and then I found that first 2 or 3 questions were having correct references. After that, all the references were fake. So That is hallucinations. By now you must be very familiar with the term. So these large language models, in their attempt to appear convincing, they have no hesitation in using small mistruths or oversimplifying complex topics. But creating an abstract based on a table submitted always raises ethical concerns. It need not be an ophthalmologist. It can be a non-medical person who can submit a fake table, and this artificial intelligence can generate an abstract which would be high class, and you can submit it to a conference. So that is raising some ethical concern. Besides creating fake tables or abstracts, it can also be used to generate fake papers. So much so that ChatGPT, especially its version 3, was used by Majovsky to prove this point, that they created a completely false paper using this some prompts, and that required nearly only 1 hour by a person who was not even trained in the use of ChatGPT. This paper was so good that human peer reviewers were finding it very difficult to detect it, and that raises very important questions about integrity of scientific research and also the trustworthiness of the journals which are publishing such papers. So besides creating fraudulent papers, there is bias inherent in the large language models. Some of the bias is intrinsic bias. Intrinsic means it is the bias which is present in the training material that is present in the bias. These are some of the examples of extrinsic bias. That video is actually a news item which came in the NBC News in the US, which said that thousands of black people were kept away from getting renal transplants because of some bias in the algorithm, because of some flaw in the algorithm. So this happened in the UK with respect to liver transplants, and this can happen with respect to corneal transplants also. So this bias, which was racial, can also manifest as a gender bias in which the large language model associates certain genders with certain professions. Like it associates males as doctors and females as nurses. Rings a bell, isn't it? They are also useful for peer review process, where they help you in proofreading and generating review comments. But again, the whole thing about bias is always there, and it lacks deep domain knowledge. So that brings us to the very important question: should large language models like ChatGPT be listed as a co-author? And at present, the answer is a resounding no, because these language models are unable to give consent for authorship. They cannot be held accountable for the content. They have no novelty, originality, or creativity in the creation of the article. So the human authors should acknowledge the use of large language models, and the responsibility and accountability lies with them. So this is a template for giving out your disclosing how you have used the large language model in your covering letter. And finally, I wish to conclude by saying that the large language models and artificial intelligence is here to stay. Learn to embrace it, but keep in mind about its misuse potential. Thank you very much for your kind attention.
Thank you, Dr. Smita. So that was a very interesting take on your experience with AI in research and publications. And now all of you know how to easily make abstracts and answers and all that, and how not to do it also. Now, Dr. Reena Abdul Rashid is going to talk about the ethical concerns and challenges of using AI in ophthalmic practice. Over to you, ma'am.
So now we heard what all things AI can do to you. So whatever its possibilities are immense. Now I will be talking about what AI cannot do, or where AI can mislead you. So the key ethical challenges when you in AI, when it is considered, the most important point to remember is that eye is not just a diagnostic organ. Actually, it is an identifier. So is it important to understand the ethical landscape surrounding AI use in ophthalmology? Yes, it is, because there are so many things still AI cannot use, some of which already Dr. Smitha has explained. But in clinical application, there are so many other things which you should be aware of. So in this session, we will be talking about what are the key ethical challenges in AI use in ophthalmology, and what are the strategies you can use to minimize them, and how you can integrate AI into your practice in a responsible manner. So whether you use AI or not, in clinical medicine, the medical ethics remains the same. The core principles are autonomy, that means you have to always respect the patient's interest and take a shared decision. And beneficence and non-maleficence means you have to do good to the patient and never do any harm. And justice, whatever you do, the services should be accessible and equally available to everyone. But in clinical ethics, you may have to add privacy and confidentiality along with honesty in the profession and error reporting as basic ethical guidelines. Now, just for you to think, I am talking about a situation. Just imagine you are a single ophthalmologist in a clinic who is using an AI-equipped machine for glaucoma screening, and the machine reported it as less than 5% chance of glaucoma, and no further evaluations were done. And maybe months or years later, the patient is coming back to you with an advanced field loss. So there are so many ethical questions that are related to this situation. So another scenario, just a tertiary eye care hospital or an institute where thousands of images are getting uploaded into the system every day. And these, whatever pictures are uploaded, they can be used in other intermediate cloud-based AI for their validation and updation. That is what happens usually. So in that system got some malicious hacker with a malicious intent hacked the system. Recently we heard that, no? It was a big news about RCC recently. The whole data was leaked. So then, is it possible to re-identify and trace the person or the identity of the person in that data set? Yes, it is possible. Now coming to pediatric ophthalmology, whatever the risks are there in the online world and cyber world is very, very complex. These data we are going to, whether it is an amblyopia prediction or a skin correction, we are taking the pictures of the kids and uploading them. So this carries a lot of complexities among, regarding consent, and the risk is long lasting. It's not an immediate risk. So we will be discussing some of the key ethical challenges. There are so many, but we will be focusing on a few. So as I already told, AI in ophthalmic images are not just images. They are actually identifiers. Iris scan, we all are familiar with, no? Iris is an already established biometric identifier. And retinal vasculature is increasingly identified as a unique feature, and that as another identifier. This is there in our Aadhaar, we know that, no? So data protection and privacy confidentiality issues are very much when we are using AI in your practice. So data protection strategies should be there whenever you are using an AI assisted machine. So this can range from encrypting the messages, encrypting the images, to restricting access to the data. And there are technological advancements like federated learning and DL, DP, etc., which are helpful in privacy protection. So privacy is a major concern. Coming next to the bias, just like in the literature bias, the clinical application can also have bias. How come that? Because already we know that AI work on the data that is already given to that. No, it learns from the data provided to the machine. And then when you give a new image, it is analyzing with the whatever learned information and then giving you the report. So if the data set that is given to the machine itself is lacking some representation of certain ethnicities, race, or age differences, or whatever, so then the machine is not familiar with the data. So just imagine a data set, a machine that is trained with a data set from a Western population, and you are buying the machine, and you are using it for your population. So we know that there are a lot of differences, racial differences in eye structures, the anatomy, iris structures, the blonde retina and the pigmented retina, everything looks different, no? So when this is adapted into our population, you should have an internal validation or a third party validation, that has to be there. And also whenever you are buying a new machine with an AI supported system, you should make sure that the data set is representative. It is not trained in a single institution, but it should be multi-centric and a diverse population, and including the rare diseases and in all age groups, depending on whatever the kind of purpose of the machine is. So regular auditing is also important, because if you are giving you only all those diabetic retinopathy pictures through a hazy media, then over a period of time it can drift and then AI can make mistakes. So the third important point is, as in the previous speakers told, you ask a question or you give a prompt, it will give you an answer. But how that answer was reached, it is not told by the AI machine. So why it happened, nobody knows. So this is lack of transparency, and it can impact the trust. And accuracy of the machine can be wrong. So this has been improved by explainable AI, which will tell you that because of these findings, it is diabetic retinopathy, the stage, and all those things. So when it is an explainable AI, then the trust is much, transparency is better, and also trust will be better. So go for an explainable AI. They are a little bit advanced, but then that has to be there. And the fourth important point is that who is responsible. In the first case, the person missed the glaucoma, the AI machine missed the diagnosis of glaucoma, and it advanced. Who is accountable? Is it the doctor who made wrote the diagnosis, or is the software developer who made the AI, or is it the manufacturer who made the machine, or is it the institution which bought the machine? Who is responsible? Actually, there are no clear guidelines. So this is this called a shared responsibility. That is the answer the AI gives, and the sharing is not even. It depends on what kind of error and in which stage the error happened. Recently, while I was preparing this, there was a usage policy that is given, that is announced by the ChatGPT. They have said that whenever you are using AI services for financial, legal, or clinical application, there should be human oversight, and they are not accountable for that. But then that is for an individual's use. When you buy a machine like with a very costly one, with AI privileges and all, then that makes a mistake. Who is accountable? It is not that clear. Now, access and equity, we are going to divide with the advancement of technology, and always will divide or widen the rural-urban divide, but that is more of a societal problem, and we clinicians are not in a position to control it. So when you see the whole picture, there are a lot of ambiguities, ethical and operational, and so we need to have regulations and restrictions which will be a responsibility of all stakeholders involved, not just one doctors or the ones who are creating it, but all other policymakers also should be involved. So India is not lagging behind. They have come, this is also very recent. This act has been there for a long time, from 2023, Digital Personal Data Protection Act. But the DPDP rules has been introduced on November 13th. This gives you rights over your data. That means from now onwards, hospitals has to ask what do you want to do with the data, whether you can share it, whether we can use it for. So maybe you have to have an additional informed consent. This is going to be implemented in 18 months, over a period of 18 months. That is what the rule says. But then in this AI, 18 days are making a lot of difference. So 18 months, I don't know what all things will change. And they have also asked private agencies to appoint data protection officers and consent managers in your system for the oversight of AI use. Now coming to the responsible integration, it should always be used as an assistant. It's a very powerful assistant, but it is never a decision-making or an autonomous body. And whenever you are purchasing equipments, you make sure that it is trained in diverse population with data sets, and locally validated, and transparency is assured. And maybe just like our hospitals having infection control committee, we talk about sterilization, all sterile precautions and all, but still we do have infection control committees. Maybe we need to have AI oversight committees, because even though you say that you have to cross-check it, many may not be doing, and you may end up in problems. So the human touch, the AI is not the only reason why we are losing a human touch, so I'm not going to comment on that. road ahead is that we all, actually we ophthalmologists or any doctors, we are all healthcare professionals and we are not technology experts. So we have to update our knowledge awareness on AI use, and we should remain updated because it's evolving in such a rapid phase, and it is going to encroach into almost all areas. And human judgment should never be underrated. Future directions, we don't know how, when our hospitals are going to look like with all these robots controlling the doctors standing behind and robots giving the instructions in front. Maybe, I don't know when. So whether ethics and the decisions can keep pace with that kind of a fast moving world, I don't know. So we ourselves have to have our own ethical boundaries. That is what I can recommend. Thank you. Any questions or lunch?
Thank you, ma'am, for talking about the ethical aspects of the whole thing and the medical legal aspect. So we have to be very careful when using AI. So the thanks for the warning, ma'am.
Yeah, it has to be. Because it's very easy and it's a shortcut, no? So everybody will be attracted to it because it gives you so convincing reports. Everything will be so precise, and the language is so impressive. So maybe you will get carried away, no? But you have to be very aware, no? That's it. Thank you.